Hello, dear doctor. Today I am discussing most important topics for MRCPCH Part 1 exam of MTAX Neonatology. Now I am discussing most important topics Neonatal Guideline from NICE Guideline 2025 to 2028. This is the Neonatal Guideline. Everyone should follow this guideline. This is the also called NICE Guideline. Now, today I am discussing most important topics necrotizing enterocolitis. What is necrotizing enterocolitis? This is the exam question in part 1 exam. Necrotizing acute inflammatory condition in newborn in intestine. What is occurs in acute inflammatory disease in newborn intestine? Where is hemorrhagic necrosis? Occurs perforation or destruction of the gut. This is the trait. Remember it: abdominal distension, gastrointestinal bleeding, nematosis intestinalis. What is nematosis intestinalis? Here in bowel or on X-ray. This is the most important. Type of necrotizing enterocolitis, abdominal distension, gastrointestinal bleeding, nematosis intestinalis. Criteria for diagnosing necrotizing enterocolitis: modified Ballot criteria. When we suspect necrotizing clinical sign, this is temperature instability, apnea, bradycardia, lethargy. Gastrointestinal sign, increased gastric residual. This is the important. This is the another important abdominal distension, vomiting. Blood in history. This is the important. In X-ray, normal or mild dilation, thick bowel. Suspected. Definitive necrotizing mild to moderately ill. X-ray show nematosis intestinalis and or gassed in biliary tract. This is the anatomy. This baby is presented with absent bowel sound, localized abdominal tenderness, cellulitis, and others. X-ray finding: gastrointestinal dilatation, nematosis intestinalis. This is the another important. Total vein cases. Next, pneumotomosis. Advanced cases also present with DIC. Metabolic condition is DIC. This is the important risk factor for NEC. Preterm baby, prematurity, or low birth weight. Most commonly, very low birth weight baby, high GR baby, absent or reverse is national prone. This is not important. Paediatric asphyxia. This for monomet. Most of the baby diagnosed in NEC after introduction of breastfeed, normally 1 and 2 weeks. Abdominal distended, no international style. Most common infectious agent, Klebsiella enterobacter. Differential diagnosis also important. Sepsis with ileus, bowel obstruction, or bolus. This is another important. Malnutrition. What investigation will you do? X-ray of abdomen, abdominal X-ray is nematosis intestinalis. What are the findings of necrotizing encephalitis in extra finding hematosis intestines. Investigation supine anterior posterior view apparatus something there. In another investigation, CBC maybe normal. Blood gas analysis is another important due to evidence of metabolic acidosis. Immediate term. Always discuss with neonatal consultant. First of all stage, nothing paroral. Is the important? Refer to the NSU or surgical center. This is another important gastric desegmentation. This is gastric dennis. Also, it is an important loss. This is the triple antibiotic. What are the antibiotic used in necrotizing and encephalitis? Triple antibiotic. Procloxacillin, gentamicin, and metribuzin. Proven NSE sometimes needed nasal CFF if breathing difficulty. If patient presented with shock, on purposes, sodium chloride, and infection. Why occurs in while hypertension occurring, shock in occurring due to hypertension. Also present it thrombocytopenia. It's another important coagulation disorder. Advance is surgical treatment. Subsequent management. If obtained some restore slowly. Then another important. Recurrence is not important. Monitoring. Well, probably. Acid base status. Long term. Not important. You also read this from this org dot entrance. Thank you, everyone.